Beautiful people, how are we all doing, guys? And how is preparations for our Osce exam, guys? Keep practicing, and by the grace of God, you are definitely going to succeed. Now, guys, with the new added skills, a lot of skills we added, if you know what I mean, a lot of skills have been added to Osce. Oracle is there, Bowe assessment is there, oxygen therapy, nasopharyngeal sunshine, nutritional assessment. A lot of skills have been added, a lot of professional values have been added, a lot of evidence-based, but guys, the pass rate is amazing. Like, I'm impressed. I just want to say I'm impressed. Honestly, guys, I'm really impressed. I've been getting too many messages of passes on my WhatsApp, on my Instagram, on my Gmail. I've not even read my Gmail now in days, but like, there are lots of passes. Like, honestly, I'm amazed. Rochelle, I'm super proud of you, Rochelle. Go and comment on this YouTube channel if you see this video. I'm super proud of you. I'm super proud of Margaret. I'm super proud of you, Joy. And I saw some few comments today on the YouTube channel from Ashe, Saji, Rachel, Ericom. I'm so proud of you all. Like, guys, I can't imagine with this new Osce coming, and a lot of people were like, it's hard, is this, and people are making good progress. People are passing. So if they are passing once, why won't you pass? If I passed once, why won't you pass? You know what I mean? So you pass. Just make sure you practice. Forget about it's complex, you're gonna pass. Okay. All right, guys. So just because Francisca and Mrs. Abosede will not let me rest, they said I must do evidence-based, the newly added one, and professional value. So I'm doing this video like 2 a.m. like 2 a.m. this morning. I'm supposed to be sleeping anyway. So today we're going to be talking about impaired performance. This is under professional values. Yes, impaired performance is under professional values. So we're going to be talking about impaired performance, and let's dive directly into this video, please.
Ryan Little.
Welcome back to my channel. Like we said, we are going to be talking about professional values, impaired performance. All right, so this is a silent writing station. It is one of the newly added professional values. The time allocated to this station is 10 minutes, so please write clearly and write legibly. All right, so I will be giving the scenario, which you get for professional value. You get the scenario and you get a plain document to write your answer. Okay, so I'm not going to be sharing the scenario, so please guys listen attentively as I read out the scenario, but I'm just going to be sharing the document you have to write your answers in. Okay, all right, so guys, I've added the join button to this channel. So if you fancy it, click on the join button, you become a channel member. The most important benefit is if you're a channel member, there's a star attached to your name, because it means you're special among others. And so what that means is anytime you ask a question, I will try my best to answer you. Okay, all right, so I just want to read the scenario now. The first thing you will get is professional values and behavior, and you will get a dot, impaired performance. Then you will see overview and you will see scenario. Okay, so it's just like this. Just like this. All right, just like this. So now let me read the scenario for you. A colleague of yours was drunk to work. A colleague of yours was drunk to work. You walked into the clinical room to prepare your own patient IV medication when you found out that this colleague of yours, Mr. Ailey, was drunk. It was just smelling of alcohol. You asked him why he was smelling of alcohol, and he said to you that he is just coming from a party. So he came from a party to work. And you looked properly at what he was doing. He was missing 1 milligram of morphine with 4 mils of normal saline. Perhaps the prescription on the drug chart states 1 milligram of morphine to 9 mils of normal saline. Upon confronting him of wrongly missing the medication, perhaps the doctor's prescription is 9 mils of normal saline plus 1 milligram of morphine, making a total of 10 milligram, while he was having 5 mils. You know, he said to you he's a senior nurse and he has been practicing for over 5 years. Should I repeat the scenario? I'll take it one more time. So A colleague of yours was drunk to the work or was drunk to work. You entered into the clinical room to prepare your patient's IV medication when you smelled alcohol from this colleague of yours. You asked Mr. Ailey why he is smelling of alcohol, and he said to you that he is just coming from a party. So he came from a party to work. You looked at what he was doing, and on the prescription, the doctor has prescribed 1 milligram of morphine to 9 mils of normal saline, but he has withdrew 1 milligram of morphine and 4 mils of normal saline. You confronted him and said to him that what you missed is different from the prescription, and he said to you that he's a senior nurse, he's been a nurse for 5 years, so you have no right to correct him. So that's our scenario. Now, using your knowledge of the NMC 2018, the code, professional standard of practice and behavior for nurses, midwife, and nursing associates, consider the professional, ethical, and legal implication of this situation. Please summarize the action you will take in a number of bullet points. This is a silent written station. Please write clearly and legibly. You have 10 minutes to complete this station. So we are going to be giving our points, and for evidence-based and professional values, you have to strictly follow the marking criteria. So I'm going to read here what I have written down. So the first point to be written is, I would recognize that Nurse Ailey is not able to practice effectively because her social behavior can potentially harm patients. I would recognize that Nurse Ailey is not able to practice effectively because her social behavior can potentially harm patients. That's number one. Number two, I will uphold the reputation of my profession and display behavior that promotes public trust. I will uphold the reputation of my profession and display behaviors that promote public trust. That's number two. I would uphold the reputation of the profession and display behaviors that promote public trust. Tick. Number three, which is another hyphen, I would raise concerns at the slightest opportunity with my manager verbally and in writing and explain the reason for my concern. I would raise concern at the slightest opportunity with my manager in writing and verbally and explain the reason for my concern. Tick. Number four, I will complete an incident report / witness statements documenting all that I have seen, including date and time. I will complete an incident report / witness statement documenting what I have seen, including date and time. Tick. So you have to complete an incident report or a witness statement documenting all what has happened or what you have seen, including date and time. Tick. Another point is, I would ensure that it is my responsibility to promote the safety of Mr. Ailey, considering the effect of alcohol on their ability to walk and drive home. I would consider or I would ensure that it is my responsibility to promote the safety of my colleague, considering the effect of alcohol to walk and considering the effect of alcohol on his ability to walk and to drive home. I'll take it again. I would ensure that it is my responsibility to promote the safety of my colleague, considering the effect of alcohol on their ability to walk and drive home. Tick. Next point is, I would consider the fact that my colleague may need further support in dealing with alcohol misuse problem. I would consider the fact that my colleague may need further support in dealing with alcohol misuse problem. I would consider the fact that my colleague may need further support in dealing with alcohol misuse problem. Tick. And finally, I will uphold the standard and values in the nursing and midwifery code and practice. I will uphold the standard in the NMC code, in the nursing and midwifery code and practice, which is practice people. Practice safely promotes professionalism. So I'll uphold the standard and value set in the NMC code and practice. Tick! And that is all. I know it is really simple, right? It is simple. Just go through it, keep going through it, and you will see that it will just stick. So the most important thing to remember is, number one, the nurse is not able to practice effectively because of his social behavior. Number two, you have to uphold that your reputation. You have to display behaviors that promote public trust as a nurse, because as a nurse you're not allowed to drink. So use your own ways. Just make sure you do it rightly, but use your own ways and make sure you don't change the meaning. It has to mean the same thing. All right. Number three, you will raise concern with your manager at the slightest opportunity. Number four, you complete an incident report and a datis report. Number five, you will ensure that it is your responsibility to promote the safety of your colleague, being that it's under the influence of alcohol and it could harm patients, and it could, so you have to promote the safety of your colleague as well as the safety of the patient. You also have to consider that your colleague need further support support in terms of alcohol misuse. And finally, it is your responsibility to uphold the NMC code and practice. I'll see you in my next video. Bye guys.